Several health insurance companies have announced that they aim to increase the prices of their Affordable Care Act plans on the marketplace for the next year, 2026, by double-digit numbers. That is the news coming out today, July 18th, and it's going to have ramifications because of recent policy that's been passed in Congress. In particular, Blue Cross Blue Shield of Illinois has announced that if you are on their Affordable Care Act plan on the exchanges, they would expect a 27% increase in the price that you pay for your healthcare. Similarly, Blue Cross in Texas is also expecting a 21% increase. Now, we only currently have data from 17 states and the District of Columbia of how health insurance premiums over the next year will be affected by some of the policy changes. Now, you might be asking yourself, Sarah, why are these federal healthcare costs increasing? Health insurance companies have stated that for the 24 million people who are on the Affordable Care Act exchanges, there has been a rising increase in the number of healthcare costs that are sought out by their enrollees. In particular, they point to rising emergency room costs, use of more costly drugs, as well as an increase in the use for behavioral health. What's interesting about these health insurance announcements, which I've talked about in several videos, is the fear that tariffs could increase the price of pharmaceuticals as well as medical supplies, which could therefore increase the cost that health insurers have to pay out to both hospitals, pharmaceutical companies. And part of this has to do with the fact that the Affordable Care Act subsidies passed in 2021 are set to expire. Now, there was talk in the last budget reconciliation bill, right, the one big beautiful bill, that Congress would extend these Affordable Care Act subsidies, which make these plans more affordable to consumers. The hope was that they would extend those subsidies into subsequent years. However, in the bill, they chose to cut those subsidies. Now, the Affordable Care Act subsidies have been a part of the Affordable Care Act for a long time. In fact, in the American Rescue Plan passed in 2021, the number of people who are eligible for those subsidies were expanded. And when the Inflation Reduction Act, which was passed in 2022, those subsidies were then extended through the end of 2025. So without congressional approval to expand those subsidies, we essentially lose them. And the other concern, which is Healthcare Economics 101, is that if you have rising premiums, right, if you make health insurance more expensive for people, the people who are going to drop out of the Affordable Care Act exchanges are going to be healthier people who don't require that much healthcare, which means that sicker patients will be the only ones on the Affordable Care Act exchanges. Now, sicker patients require more care, which means you have this spiral of health insurance companies therefore having to increase premiums, people then dropping their health insurance coverage, and more sick patients are the ones who are on that care. This is known as health insurance unraveling, and it creates a very unstable insurance market. It makes the insurance market a lot more risky, and it puts all patients who are on health insurance at risk for higher costs, and just for the entire private health insurance system to fail. Now, the states that are most likely to be affected by these Affordable Care Act subsidies expiring at the end of this fiscal year are states that receive the most amount of those subsidies. If we look at this map of the United States, Florida and Texas are the two states that receive the largest amount of Affordable Care Act subsidies. And it is by that logic that when the Affordable Care Act subsidies expire, it is those states and those health insurance markets that will experience the greatest increase in premiums for the Affordable Care Act plans on the exchanges. So to put that into numbers, if you are a family of three and you earn $110,000 a year and you are enrolled in a silver Affordable Care Act plan, which that plan has pretty moderate premiums compared to all of the other plans, you could see your healthcare costs increase by a little under $800, so that your premiums that you pay for the year are around $1,500. So that's almost a 50% increase. And that doesn't include the increase in prices that insurance might pay for premiums. So if insurance companies are saying that they're going to increase their plans by, say, 15%, that monthly bill could climb to a little under $1,700 a year. And of course, the concern I always have as a health economist is if you remove the subsidies and increase the cost of the Affordable Care Act marketplace plans, how many people would choose to just forego their insurance? And so yeah, we'll just have to see what happens. There's been some movement in Congress to try and rescind some of the policies when it comes to Medicaid and the cuts to Medicaid. So it will be interesting to see if anyone in Congress or the Senate moves on these subsidies for the Affordable Care Act. But as of right now, I don't see anything legislatively, but I'll be sure to keep you up to date with what happens. And as always, if you have any questions, let me know.